Thank you, Presiding Officer. I welcome this debate, marking another step forward in the delivery of health and care services which understand and support people with chronic pain. And I've listened very carefully to the very informative contributions from the members in the Chamber, especially to Christine Graham's. Chronic pain is defined as a pain that persists beyond normal injury healing time and reoccurs for longer than 3 months. It's a separate condition in its own right and frequently presents alongside other long-term health conditions. And it's often said that living with chronic pain is hard, but dealing with those who don't care or understand can be even harder. Lived experience tells us that older people represent a significant proportion of those with chronic pain, and it's sometimes responded to with an uncharacteristic lack of empathy from healthcare professionals, leading to poor investigation and little or no therapeutic intervention. We know that chronic pain is complex and unique to every single individual. But as people age and present with chronic pain, we hear reports of their experience of accessing local healthcare services being one that is less than compassionate and lacking in empathy. Unusually for the caring professions, an older person approaching their GP for advice, guidance, treatment options can find the response to be based on assumptions and inevitability, a response that blames old age itself rather than focusing on what aspects of the ageing process might be causing chronic pain and how best to treat and alleviate the patient's experience of that pain. Moreover, there is evidence to indicate that there are links between adverse experiences and the incidence, the impact of pain. So when an elderly person goes to see their GP for advice and support and meets with a response which doesn't acknowledge or engage their experience, potentially, the impact of their pain can be intensified. Indeed, a key finding of the framework we are debating today is that people with chronic pain feel that the lack of recognition of its impact on their everyday life, including from healthcare professionals, increases the challenges they face. Like the rest of the population, the debilitating effect of unmanaged chronic pain reduces the quality of life and the well-being of older people. The Action Plan notes an approach to care that prioritises empathy and kindness in order for it to be effective. And I really like that these words are explicitly included in the Action Plan. Everyone living with chronic pain has a right to expect such an approach when they approach the NHS for care. I hope that when the plan talks of drawing on the expertise of people with lived experience of chronic pain, that this will include older people. The voices need to be included in the development of training for health professionals. Therapeutic touch is confirmed by an increasing body of scientific research and practical evidence as of huge potential in reducing the impact of pain. And I hope that the toolkit for healthcare professionals can reflect treatment options such as that are appropriate for older people, including physiotherapy, massage and other bodywork therapies. It's almost impossible to underestimate the importance of ensuring that health and care workers, including GPs and their team members, have an understanding of the challenges of living with persistent pain to ensure that they provide informed and compassionate care and to enable them to signpost older patients to appropriate accessible treatments. I welcome the fact that the first aim of the implementation plan we are debating today is person-centred care, and the actions identified to deliver this include developing a knowledge hub and a pain-informed toolkit for healthcare professionals to promote in all care settings, identifying existing best practice already being delivered and establishing how the principles of trauma-informed practice can be incorporated as part of pain management care and support services is also a valuable element of the way forward. In conclusion, Presiding Officer, I welcome today's debate and the commitments made in the Action Plan. Fostering an approach based on compassion, empathy and respect is the right thing to do. I hope that the work that follows will lead to a significant improvement in the experience of accessing NHS services for all those living with chronic pain, including our valued elderly population.